Hello everyone, welcome to another time of Health and Wellness with Olajumoke. Today we'll continue our discussion on anxiety. In my last video, I talked about occasional anxiety, which is common to almost everybody. But then I also established that there are different forms of anxiety, one of which is Generalized Anxiety Disorder, GAD. So today we will be talking about Generalized Anxiety Disorder, and permit me to use the word GAD very often for this presentation today. So let's start. Occasional anxiety is normal part of life, just like I established in my last video. Many people worry about different things such as health, money, family problems. But people with generalized anxiety disorder feel extremely worried or nervous more frequently about this thing and other things, even when there is little or no reason to worry about them. GAD usually involves a persistent feeling of anxiety or dread that interferes with how people live their life. It is not the same as occasional anxiety or worrying about stressful events or life events. People living with generalized anxiety disorder experience frequent anxiety for months. This can even last for years. It usually starts slowly. Research believes that this starts at age 30 for some, but it can also happen in childhood, and it is more common in women according to the National Institute of Mental Health. So what are the symptoms people see in those who have GAD? It can be as a result of side effect of medication or substance use. It can even be related to medical conditions like hyperthyroidism that increases the hormone. Some of the signs and symptoms we may see in people who have GAD includes restlessness, trembling, tense muscle, headache, irritability, sweating, hot flashes, lightheadedness, trouble breathing, nausea, urinating often, increased muscle tension, trouble falling asleep or staying asleep, poor performance at school, sporting events, or feeling overly anxious to fit in. So what can you do when you notice all this, or you found someone that has all this? My first recommendation will be for you to seek mental health professional support. You can't do this all by yourself. Visit with a provider, a mental health specialist who can come alongside with you and help you so that you can become better. One of the things they will suggest to you is psychotherapy. And there are two forms of psychotherapy often used in anxiety treatment. One is cognitive behavioral therapy, CBT. And the second is acceptance and commitment therapy, ACT. This is very known. For CBT, what they do is they give you different way of thinking, behaving, and reacting to situation that can help you feel less anxious and worried. ACT, on the other hand, is a known one. In this, they gives you strategies that can help you with mindfulness and goal setting to reduce your discomfort and anxiety. Other things that have been used for anxiety treatment include medication. We have antidepressants, which can also be used for anxiety. We have anti-anxiety medications such as benzodiazepine and the likes. One other thing I like to promote, if you've listened to me before, you know I'm a huge fan of support groups. Support groups are always helpful, irrespective of what you're going through, be it mental health, medical health, anything whatsoever. Find people who have gone through the same thing you are going through. Learn what they do, what they apply that makes them better. Why they are still here today is because something worked for them. You don't know that thing, so look out for it. You don't need to stress yourself looking into so many journals, articles, browsing so many solutions out. Just lean on the support of others. Look for support group for those who are going through generalized anxiety disorder and join the support group. Learn from them things that have worked for them. It may work for you, it may not work for you, but it won't be bad to give a trial. So look out for support group. Another thing I suggested in my first video for controlling anxiety is practicing relaxation strategies. This can include things like visualization, meditation, yoga, deep breathing, and the likes. Another recommendation I have is to actively work toward changing negative thoughts. This means you consciously replaces negative thoughts with positive thoughts. When something negative comes to you, learn to combat it with something positive. People call this positive confession. I've utilized this also before, and it works. You must learn those words you can use to combat those negative words that comes to you. And I'm a believer. The Bible says the power of death and life lies in the tongue, and those who love it will eat the fruit thereof. So that means you become what you profess. When negative thought comes to you, don't just think about it. Don't just leave it in your mind. Speak out positivity to combat that negativity. Another thing that I know that is helpful is to engage in healthy lifestyles that minimizes stress. Things like taking a walk, go for cycling, putting your confession in your ears. Volunteer in events that birth next generation. It helps you to lose consciousness of those negative thoughts and to focus on something positive. Also, exercising, mindfulness, and meditation are quite helpful. My last tip for you today will be, if you have an addiction to either nicotine, alcohol, or substance abuse, seek support. If you are using any of this, you are addicted to any of this, I would encourage you to seek support. For more information about everything I've talked about today, you can look up Mayo Clinic, Johns Hopkins Medicine, and National Institute of Health for more information. Just like I usually say, I would like if you share with me in the comment section what you learned today or what stood out for you. So we'll meet again on Health and Wellness with Olajumoke. Stay positive and stay healthy. Bye for now.